No need to apply social distancing rules to this particular Downing Street resident. But the Health Secretary clear that all our efforts to keep our distance during the lockdown are finally paying off.
It is making a difference. We are at the peak. But before we relax any social distancing rules or make changes to them, we have set out the 5 tests that have to be met. First, that the NHS can continue to cope. Second, that the operational challenges have been met. Third, that the daily death rate falls sustainably and consistently. Fourth, that the rate of infection is decreasing. And most importantly, fifth, that there is no risk of a second peak.
The NHS coping with huge numbers of patients, but problems still on making sure their staff have the right protective kit. This consignment finally arriving from Turkey overnight. It was due on Sunday.
I make no bones about it. There have been challenges, there still are challenges. We're not there yet. Amidst a global shortage in personal protective equipment, we've distributed over 1 billion items to the front line where it's needed most. And I'm on the phone every day pursuing the next batch of deliveries from abroad.
PPE a logistics problem, bigger strategic questions on the horizon now too. The Health Secretary said today we've reached the peak of the crisis. Is this the light at the end of the tunnel that we have been talking about and waiting for?
So there is certainly light at the end of the tunnel. There is a glimmer. We're coming through the peak, but we're not there yet.
Politicians reluctant to level with the public about what life after the peak might look like. The Chief Medical Officer more forthcoming.
We have to be very realistic that if people are hoping that it's suddenly going to move from where we are now in lockdown suddenly into everything's gone, that is a wholly unrealistic expectation. We're going to have to do a lot of things for really quite a long period of time.
And on PPE, honest about the challenges and earnest in his concern for NHS staff. But NHS workers just want to know they have the equipment they need when they turn up at work. Can you tell me when you expect the shortages to be resolved?
It is very clear that at the moment we are tight at different times for different items of PPE. So at this point in time, we are still close to the line, but at a national level, we're not underwater on anything that I'm aware of.
This manufacturer, one of thousands who believe they have something to offer.
We might be able to mobilise 1 million to 2 million square metres per month, and that could be 500,000 to 700,000 gowns per month. What we've done is we've actually purchased as much viral barrier film as we could. We've flown it in at great expense into the UK, and we've made that solely available to the NHS. We have no orders against that at the moment.
You're trying to hold back the supplies for the NHS, but the government haven't contacted you. There's an execution issue here, isn't there?
Yes, there is an execution issue. I think the issue is that the government has relied heavily on obviously importing PPE.
Government's PPE problem is a priority now, but this crisis moves into another phase soon. Nearly a month into lockdown and the peak has arrived. It's not the beginning of the end of this crisis, but it could be the end of the beginning. Beth Rigby, Sky News, Westminster.